mean, they're good. My son's a good kid. You know, my husband, he's good to me, so I don't want to add any more.
So you feel that you have a supportive family?
Yeah, they're supportive.
Okay. But you don't disclose that kind of information to them?
Yeah, I don't want to stress
Any
them.
friends that you talk about with?
I talk about things, but not about killing myself. I mean,
Mhm.
I'll scare them away.
You only have the one child at home?
Yeah, I just have one child at home.
Okay. And any children that live away from the home? Any other children?
Well, I did have two sons. My other son committed suicide about a year ago.
Sorry to hear that.
So he would have been like 21 in 2 weeks.
Okay. So it sounds like you're coming up to a pretty tough anniversary date. Do you ever feel that you might want to join him?
Yeah, sure. I mean, sometimes that would be easier than struggling through all of this and just thinking about him all the time.
And you must feel sad having lost your son?
Yeah, I'm really sad. I feel really helpless and yeah.
How about eating and sleeping?
Well, I don't have an appetite, so I can go like a couple of days without eating. So that's been a real problem. The doctor's worried about the fact that I've lost like 30 pounds in the last couple of months. So, yeah, I don't have an appetite, and I can't sleep because I'm just always thinking about stuff.
Now, Glenda, some of these questions might seem a little tough or hard to answer, but I hope you can be honest with me. Have you attempted to kill yourself in the past?
I've thought about it. I've had pills in the house. I've got guns in the house, but I haven't actually harmed myself.
Okay, so you haven't actually taken an overdose of your medication or taken the guns out of the cabinet? Have those things occurred?
Well, yeah, about a week ago I did take the gun out of the cabinet and I hung on to it for a while. But I put it back. I mean, I hit the key at that point, but I mean, I hit the key for me.
Yeah. Okay, do you ever think that you may not be able to control your impulses or your thoughts about
Yeah, I think that's
taking the next step?
Yeah, I think that's why I came out today. I am a little afraid that it's, you know, what's that going to do to my other son and my husband? You know, I don't do something about this.
Did you talk about that to your husband at that time when you did that, about your fear of the guns, or did you make any indication to him then?
No, I don't tell him that. He's got enough. He lost his son.
Have you ever written a suicide note, or did you write a suicide note?
Yeah, I mean, I wrote it the day I got the gun out of the cabinet. I mean, I
So it
didn't
sounds
want to
like-
leave without my husband and son knowing that, you know, I love them and it was nothing to do with them. I just can't deal with stuff.
Have you ever been diagnosed with, well, you said you saw your family doctor for depression. Were you diagnosed at that time with any mental illness?
Yeah, he diagnosed me with depression a few years ago, and then, of course, a year ago, when my son died. I was okay for a while because I was trying to keep my head above water, and then about 6 months ago, it just crashed.
Okay. Do you think that you'll continue to have suicidal thoughts if you don't get any help?
Yeah, I'm worried I can't do this on my own.
Okay, so you're having a hard time coping. All right. Are you using any alcohol or drugs to help self-medicate maybe, or to ease your pain?
Yeah. Sometimes I try to have 2 or 3 drinks at night so I can try to get some sleep.
Right.
I mean, I do smoke marijuana occasionally, and that kind of just mellows me out and gives me a bit of a break from the thoughts for a while.
Okay. Have you used those substances since your son's suicide, or in the past also? Have you ever been addicted to any other substances? Or
No, I just started using it just since my son died.
Okay. All right. So you said your doctor diagnosed you with major depressive illness, correct?
Yeah.
A few years ago, yep. Do you have any medical issues?
No. Blood
Mm.
pressure problems sometimes, but I don't have to take any medications for it.
Okay. And your anxiety, do you think your anxiety is as bad as the depression, or do you think it goes hand in hand?
Well, I feel anxious a lot at the time. I get easily overwhelmed and
Okay. What about the depression and suicidal thoughts affecting your daily living? Do you have a hard time getting to work? Are you still working at this time?
No, I lost my job about 3 weeks ago now, I guess. I was just too depressed. I couldn't sleep. I couldn't get up in the morning. I was late. I was missing days. And they tried to put up with it over the last year, but
So it sounds like you have a lot of stressors right now.
it feels like it.
Mm-hmm. Okay. Do you think that after discussing with the doctor, perhaps a stay in the hospital might help?
I guess.
Would you feel safer if you were kept in the hospital?
I guess. I can't really. I don't know what else to do, so I guess I'd have to think about that. See what he says.
Okay. You said that you don't have any contact with support services outside? No outpatient counseling? Okay. What about a church? Do you belong to a church or anything that gives you support?
No.
And you said that you have one child, your son, at home. Is he going to be going away for school next year or this year?
He leaves. He leaves like in 2 months.
Okay. And that's going to be another huge
Yeah.
change for you to...
I'm going to miss him.
Do you think that Glenda, that you normally feel good about yourself? That you
Yeah, I
don't
mean, I
have...
used to be really active. I was so active with the kids. It was always, worked full time. There was always things going on with the kids. Life was so busy. I mean, you didn't have time for all this
Right.
stuff.
So, I know it must be hard for you to talk about your son. What was his name?
Jeffrey.
Jeffrey. He must have felt really lonely when he
Yeah.
unexpected.
Yeah. I mean, why didn't he talk to me about that? Why couldn't he talk to me about that?
Has your family life changed a lot since Jeffrey died?
Well, everybody's sad. I mean, it's been a year from hell.
I can imagine. And you've never, any family history in your family besides your son, Glenda, that suicidal?
Yeah. My uncle, my father's brother, committed suicide about 4 years ago.
Okay. Was anyone in your family ever diagnosed with a mental illness? Depression, anxiety?
My dad has depression as well, and his sister.
Okay. Well, I think what I'm going to do is have the psychiatrist come in and we can sit with him and discuss a little bit further about what's going on. The suicidal thoughts seem to be, quite evident and happening more and more. So it's a possibility that he may want to, after he's in assessment, keep you in hospital and see what we can do to help you, keep you safe.
I guess. Talk to him. We'll see.
Okay. All right, thanks.